So my name is Dr. David Dahlstrom, and I'm an autoimmune functional medicine doctor. So what we're doing is changing the way that autoimmune disease is dealt with worldwide, reversing and preventing autoimmune disease as opposed to the only thing that tends to be offered to folks, which is medicines that suppress the immune system and only put a temporary bandage on a few symptoms. We're actually helping people understand how they can reverse the process if they already have it or prevent it from happening in the first place. So what motivated me to work with medical liaisons was really Ginger Allen. She has an infectious enthusiasm, an infectious love for what she does, while at the same time it is very concrete and exactly what has to happen in order to be successful. So the doubts I had with hiring anybody as a marketing and management group was, am I going to get what I'm hoping to get ultimately? And is this the right person to get me there? And of course, financially, is this something that is conceivable? I think the three biggest challenges that I had prior to hiring Ginger Allen was getting the word out that reversing and preventing autoimmune disease is actually possible, and then getting the word out so that people actually start educating themselves and getting that educational material out to them so they can educate themselves on how to do this, but also then really change mindsets about how you look at this whole thing as a whole, because the pharmaceutical industry has a very strong message, and it's kind of hard to get a message out there that's not medication based. Well, I think my practice would not be nearly as strong if we weren't able to get the word out to people about what we're talking about here, but also with our changing the way that autoimmune disease is dealt with worldwide and trying to teach other people how they can, other medical practitioners, how they can do this, or people themselves, how they can do it themselves, is we just wouldn't have been successful with our overall goal. But with Ginger Allen's group's help, we've really been able to get the word out so that people understand that this is doable, but also it's something that they can actually do a lot of themselves. Well, I'm an overachiever, and changing the way that autoimmune disease is dealt with worldwide is a pretty big goal. And my personal satisfaction comes from being able to heal people in the clinic, which I love, but also I really wanted to heal people that I might not even see as a patient. And that's what I was looking for. And I would feel like I was not doing the best I could possibly do if I wasn't able to get that done ultimately. But I needed help to do that. I think what Medical Liaison did to help me really fix these challenges was keeping me from jumping ahead. Really, we got to get the foundational pieces in place if anything that we do is going to have the bang for the effort that we wanted. And I kind of jumped ahead and was doing social media and trying to do all this kind of stuff without having some really foundational pieces in place. And that's what Ginger's group is so great at. They're like, well, okay, these are the foundational pieces that are missing, and you're not really getting bang for your effort, your time, your money, and all these kind of things. And so we actually had to step back and kind of restart, and then we really got this momentum going that we're just riding this huge wave now a couple of years later. So since joining with Medical Liaison and Ginger Allen and her group, we've really been able to exponentially increase our reach as far as sharing information with others around the world. And inherently, that's led to more clinical clients, which is very satisfying, including I'm working with about a 5-month waiting list now for new patients. And so the clinical picture is really beautiful, sometimes almost overwhelming, all the patients, all the people that want to be seen once we got the word out. But also we're able to really touch people from around the world and teach them how they can do this, some of this on their own, and really have this impact on people that are not even our clients. But of course, having a large waiting list of clients is always nice. Well, the kind of services that functional medicine doctors provide is so needed that as long as you can get the word out that you're there and that you can help people, that's going to be a big boom to your practice. But then to be able to have somebody like Ginger's group doing that kind of work for you, I would think that easily in a practice, it'd be 100%, 200% increase in client numbers. My practice was fairly well established. I've been doing that for about 5 to 6 years before I met Ginger. And so my practice was already well established We have a reputation. There was a waiting list already, but then with Ginger's group's help, it's really been exponential growth for us to the point where we're 5 months out for new patients. A lot of what I measure success is people coming to see me, the clinical patient, saying, "Oh, I've been reading about you for a long time. I've been following you on social media. I've been reading your blog posts. I love what you post. It's fascinating, and I want to become a client." But also, I get feedback through social media where we get people saying, "Thank you so much for what you're doing." These live question and answer sessions that I do, all these other kind of things. The feedback we get, like just the thank yous for sharing the kind of information we're sharing, that I would never have been able to get to those people if it wasn't for Ginger's group. That's the kind of feedback I want to hear. Well, I would tell somebody who's thinking about hiring them that do not wait. You should do it yesterday, because besides that infectious enthusiasm and infectious love for what she does, the nuts and bolts are all in place. And when I came to her, there was things that I was looking for that she had never done before, and that nobody had ever done before. What I'm doing is so unique. Nobody's done some of the things that I'm trying to do. And no matter what challenge I gave her, she came up with solutions, tasks. This is the first thing we do, second thing, all the way down the line. It's just very methodical and very well thought out. And there's absolutely no goal that I could set that she wouldn't have answers as far as how to get there. And her group is great. About 90% of my practice is women and children. So I'm trying to empower women, including women medical practitioners, but non-medical women practitioners, how to help their health, the health of their family, like their children and their aging parents, and how do you juggle work and as a caregiver and all this kind of stuff. Well, Ginger is basically doing the same thing with her medical liaison business. She's empowering women from around the world to be able to use their expertise in a way that allows them also to have time to care for their family and their aging parents and their children. And this is great for their entire household, which is basically the same thing I'm doing medically. She's able to do for the people that work with her. And I've got a chance to interact with people from India, South Africa, all over the United States, because she has these experts that they're trying to balance work life, family life, caregiver, parent life. And Ginger gives them this opportunity that most people are not given. And that always rang so true for me. It seemed like the right thing to do. Well, I think one of the things is inherently is trust Ginger. I mean, she just is somebody that you talk to for 5 minutes and you're like, oh my gosh, this is one of the nicest persons I've ever met. This is one of the smartest people I've ever met. But also what really rang true for me was she's explaining her business, that she was empowering women to have a professional life as well as optimal family life all at the same time. And when I kind of heard that, I'm like, that's what I'm trying to do through medicine, connected with what I'm looking to do in the medical world, and she's doing it in the business world. And I just thought that was the greatest. Well, I think one of the things that really blows me out of the water is that she'll find an expert for whatever I need done. And it's not based on geographics. It's not based on, that kind of stuff. She really searches out the best people with the best skill set, and whatever skill set I need for a particular thing to be successful, she'll find the person. And that person might be halfway around the world. I think one thing that blows me out of the water often is her ability to do things so efficiently. A great accent, and we looked into like British accent, people that could do the audiobook and this kind of stuff, and the cost was going to be, quite impressive. And it turns out that one of the people working with Ginger was from South Africa and had the skill set to do it, and actually was the one that had helped me put together my educational course all the way to South Africa to find somebody to get me connected for the educational course. Well, then she came up with the idea, well, how about the person that did that doing it, because she's got the great accent as well. And sure enough, we were able to get it done with the great accent that I was looking for at a tenth the cost of what it would usually cost. Well, if somebody's just hired Ginger Allen and her group to help them, as I would say, trust the process. Ginger really knows the step-by-steps that has to happen in order so that you're not wasting time and effort and money. Even though it may seem like, well, I want to get here faster. Well, she's not going to let you get there until you're ready to get there. But when you get there, you're going to be full-blown successful because of all the steps that she made sure that we didn't miss anything in doing to set up these foundational pieces. I think it's important to know that Ginger is so honest, and she'll tell you what you don't want to hear just as well as she'll tell you what you do want to hear if it's what really is true. And so she doesn't have any qualms with saying, listen, this is what we have to do. I know it's not what you want to do. I know you're thinking we're ready for this next step. We got to do this first. And I think if you trust the process, trust Ginger's expertise, she'll definitely get you there. And because you really trusted the process, you're not wasting a lot of that time, effort, and money that you would be, trying to go it on your own, of course, or with most other people, I believe.